This is the injury report presented by NYU Langone Health. Patrick Mahomes and Micah Parsons are the latest elite NFL athletes to go on IR, that's injured reserve, with a torn ACL. So in today's IR, that's injury report, we're talking with Dr. Michael Alaia, sports orthopedic surgeon at NYU Langone Health, to break down both of these guys' tears and if they're going to be able to return to action by the start of next season. Doc, what's going on, my man? Appreciate you hopping on today. Let's get straight into this, because when we talk about this ACL injury, we saw Malik Neighbors tear his ACL when he was coming down trying to make a catch. Micah Parsons planted awkwardly, he tore his. And then someone came down on Patrick Mahomes, he tears his. Three players, three different ways to tear the ACL. Now, Mahomes tore his LCL as well, but can you break down what happens when a player tears their ACL in the NFL?
So the way they tear it in the NFL is pretty similar to how ACLs tear around the world. And I guess if we want to break it down into what the function of the ACL is, then we have to start from scratch. So the ACL is one of four main ligaments inside the knee that help protect it and help keep it stable. The ACL goes from the center of the thigh bone, the femur, to the center of the shin bone, which is the tibia. And it's important for a few reasons. Number one, it prevents the shin bone from sliding forward on the thigh bone. But more importantly, number two, is it controls rotational stability. So the ability to cut, pivot, change direction rapidly, accelerate and decelerate. That ligament helps keep the tibia bone centered underneath the femur. And without that ligament properly functioning, then the rest of the knee could have damage, whether it's the meniscus or the cartilage, the shock absorbers of the knee, other ligaments, etc. So when that injury happens, typically it's from a rotational component where either the player gets their foot caught on the ground, a non-contact injury, which is probably the most common way this happens. Probably about 80 to 85% of the time, it's a non-contact injury where nobody is around them. They're just changing direction very quickly, and all of a sudden they feel a pop and they're down. Or it could happen the way that Mahomes' injury happened, where somebody came down on the leg and forces the leg into a position that simply cannot release off the ground. So with that force going through the knee, through the leg, and the inability of the foot to kind of slide off the grass, it gets kind of planted in there. What ultimately happens is it gets stuck in there, the tibia rotates, the femur rotates, and you feel a pop inside the knee.
All right, let's get into the return to action and the recovery here, because in some of the pictures that we had shown, that you could see Mahomes needed to be carried off the field into the locker room, whereas Micah Parsons kind of just got up and walked off the field on his own. So what does that tell you about the grade of the tear? And since Mahomes also tore his ACL as well, who has a harder road to recovery and being back to their elite form, Micah Parsons or Patrick Mahomes?
Well, I think it's tough to say which one has the better chance of going back to their form because they play different positions.
Mm.
Mahomes is a quarterback. He can drop back in the pocket, and yeah, he does run. He is mobile, but it's a little bit of a different energy expenditure on a quarterback, let's say, compared to Parsons, who is blitzing and trying to cover lots of defensemen. So I think that the strain on these athletes' knee might be different in terms of the position they play. When you tear your ACL, it could be very painful, it could be very swollen, or it could be minimally painful and minimally swollen. And we certainly see cases where patients come to the office and they don't have that much swelling, they don't have that much pain, yet to the surprise of everybody, they've torn their ACL. Or you could see patients with a very swollen, biologically angry knee. They come into you and you're like, okay, there's something serious happened inside this knee. Now, when you talk about the LCL with Mahomes, I think most of the time LCLs can be treated without surgery, but sometimes if they're avulsed, meaning they're ripped off the bone, whether it's the femur bone or the fibula bone, sometimes they can be fixed or repaired primarily. Sometimes these injuries need to be reconstructed with new tissue if the tissue severity is pretty significant or if the injury pattern is very significant in and of itself. Now, I'm certainly not privy to the details of what happened exactly during surgery and what they found in terms of the quality of the ligament, but if it had to be repaired, then I trust the physicians that do that surgery very, very implicitly, and they know what they're doing. So I think that Mahomes' recovery is going to be good. I think that Parsons' recovery is going to be good. We are at the level now where Our surgical technique is excellent. The rehabilitation is excellent. And these players have access to the world's greatest rehabilitation. They start day one moving, strengthening their quad, eliminating the swelling inside their knee. So, I'm an optimist when it comes to professional athletes getting back out there to play. Nobody knows what they're going to be at when all is said and done. It could be 100%, it could be 110%, it could be 90%, it could be 70%. We just have to rely that the treatment team and everybody on board is going to do the right thing. And these guys are going to put their all into their recovery, which I have no doubt. And I look forward to seeing them on the field next season.
We talked about two professional athletes who are making well over $100 million in their contracts. $1 million question here: when a non-pro athlete comes into your office with an ACL tear, what steps do you take with the patient to get them back to 100%? Is their rehab and recovery different from a Micah Parsons and a Patrick Mahomes?
Well, obviously, the demand that goes through those athletes' knees are different than the average Joe or the weekend warrior that comes in with a torn ACL. But at the end of the day, everybody still wants to be 100%. They still want to have as much functionality as humanly possible. And, people don't really like to accept mediocrity. Me for one, obviously, I don't like to accept the feeling of a knee that might still be a little bit unstable or still have a little bit of give to it. So, we treat every patient like they are an elite athlete because we want them to return to everything that they enjoy doing with no pain, no swelling, no instability, and no apprehension, and the feeling that their knee is going to be completely stable. So for us, it's important to treat them like you would the 17-year-old athlete who tore their ACL that's looking to get back to football or basketball or baseball. So you start by reducing the swelling in their knee. You get them into physical therapy sometimes to work on early range of motion, reactivating their quadriceps. Sometimes we have to aspirate some fluid or blood out of the knee when it initially happens. And if and when the time is right for surgery, because everybody has the ability to make those decisions for themselves, if the patient ultimately decides that surgery is for them, then we treat them the same way. We give them a good new ACL. We start physical therapy and rehabilitation immediately, and we work with the patient every step of the way to get them exactly where they want to be when they want to be there. But ultimately, the time frame is still going to be the same, 6 to 12 months for everybody.
That's why you guys are the best in the business, Doc. Appreciate you hopping on with us.